Welcome to The Savvy Patient, where we make medicine make sense.
I'm Dr. Gillian Goddard. I'm an endocrinologist and an expert in women's hormonal health with 2 decades of clinical experience.
I'm Erin Stein, a writer, editor, filmmaker, and media psychologist, but definitely not a doctor.
By looking at the data and breaking down the research, we will help you get savvy. Remember, this podcast is not meant to replace medical advice from your own doctor. Welcome to the Savvy Patient Podcast. I'm Dr. Gillian Goddard, and I'm here with my high school bestie, Erin Stein.
We thought we would just talk a little bit here to explain who we are, introduce ourselves, and talk a little bit about what we hope this podcast will be.
Erin and I have known each other for a very long time.
We're not going to tell you how long.
You can probably do the math. We're middle-aged ladies who met in high school. We were both in theater together. And then in college, we both studied journalism. We even moved to New York around the same time. And fun fact, briefly shared a studio apartment.
And we're still friends.
And
then one day, Gillian called me and said, I'm going to be a doctor.
I remember that.
And that's a very Gillian thing to do.
Even though we have all these things in common, our day-to-day lives are actually very different. We come to our conversations with different background and different life experiences. So Erin has 2 cats. I have 4 kids. I think Erin has feelings about that.
It's a lot of kids.
It is a lot of kids. I like them all.
That's good. It's good if you like your own children.
It is.
I mean, I like them too. It's just a lot when you visit Gillian's house. Yeah, that's all.
It is. It's true.
To be fair, if I had 4 cats and you came to my house, you would think that was a lot of cats.
I would.
We thought we should explain the name, The Savvy Patient, because that is what we want you to become by listening to this podcast. So what does that mean? What is a savvy patient? A savvy patient is someone who wants to take charge of their healthcare using the best available information. And a savvy patient is interested in how the research is done, how the medical guidelines are formed, and what that means for them.
I think a savvy patient is someone who knows interesting things about medicine too. Like, did you know that during pregnancy, the human body actually works 40% harder? Savvy patients also know things like Ozempic and Wegovy are the same medicine. They're just branded with 2 different names for 2 different uses.
In this podcast, we will be talking about perimenopause, menopause, explaining the difference or not, all the fun stuff related to those periods of our life, the hot flushes, also known as hot flashes, periods, brain fog, everything from PCOS to breast cancer, which I actually went through last year, so we'll definitely talk through that. We are coming at all of this from a hormonal perspective, and that is Gillian's fault because Gillian is an endocrinologist. Why would you go see an endocrinologist? What do you do all day, Gillian?
So endocrinologists are doctors who study hormones and the glands that make those hormones. Hormones, I think it's best to think of them as like instructions that tell different parts of the body what to do. When most people think of hormones, they automatically think of estrogen and testosterone, the hormones that are involved in making babies. But we actually have dozens of hormones, and they do all different things throughout our body. They tell our brains to be alert. They tell our hearts how quickly to beat. They tell our guts how quickly to move food through the system. When things go awry, it's a little bit like trying to put together an IKEA coffee table without the instruction book. So as an endocrinologist, it's my job to help get things back on track.
It's important to note that even though hormones are often discussed as women's health, everybody has hormones that do all the important things your body does. It's not like only men have testosterone. Women have testosterone and men have estrogen. We all have the same hormones. So it's what are these hormones doing?
Yeah,
right?
We just have them in different amounts. And that is really what leads to some of the differences in how our bodies function. But there's a lot more that is similar between men and women than there is that is different.
Women do have some specific things they deal with.
We do. We do. We go through a number of different stages in life related to our hormones, and we'll definitely be getting into that.
What are some things that someone comes to see you for? Because hormones, like, yeah, we all have them. We have no idea what they're doing in there. And how do you know that you need to see a doctor about them?
And I see lots of women for lady issues, no doubt about it. But I also see people because they're having problems with their thyroid hormone. And their thyroid gland. I see people to help them with their diabetes, both type 1 diabetes, which people usually get in childhood, and type 2 diabetes, which affects more people in midlife. And now a big part of my job is helping people with medical weight loss as well.
I worked in publishing for many, many, many years, but I've been getting a master's degree in media psychology. So that will definitely play into this podcast as well, because how we talk about these things, the way the media portrays health and how women deal with health, all plays into our psychology and our feelings about all these fun life changes that we all get to go through.
100%.
We're also going to talk about things like body image, just how sexist medical language and research can be, all the implications of having kids, not having kids. We come to that from both sides. And we will keep you up to date on all the GLP-1 RAs. Did you know fun things like Gila monster venom is how we figured out how to make those medications?
Yeah, pretty great. Gila monsters are from Arizona. That's where we met.
Yeah, we like Arizona. And yes, once in a while, we will talk about men's health because we all have hormones. So
We do.
But
we do.
we'll be a little focused on the ladies. We will be swearing on this podcast. So brace yourselves for that. We are going to be talking about female issues, which requires some swearing, I feel like.
I think that's right. But maybe don't listen with your kids in the car. Quick note on language, though. Experts like myself, endocrinologists, were actually among the first people in medicine to recognize that gender isn't binary. We know that when we refer to people with ovaries as women or girls, that doesn't cover everyone. However, most medical research is actually based on this construct that all people fall into just two categories, male and female.
So we want to acknowledge this, as we know that the labels we will often use won't capture everyone's experiences, but we are going to be talking about the research a lot. And so we have to talk about it in the way that it was done and its context. We also want to acknowledge that both of us have privileges. We are both white. We have access to healthcare. We have the funds for insurance coverage. And this is something we also want to talk about. We want to get into all those nuances in future episodes.
Your experience is real, and you deserve to feel your best.
Help us help you get savvy. Send us topics and questions using the email address askask@thesavvypatient.com.
Listen to new episodes on Wednesdays.
Follow us on all the things.
And subscribe to the Savvy Patient Substack.
Please rate, like, and subscribe. And tell all of your friends.